If your students are struggling in clinical and they're not exactly sure what steps to take, but they're doing really good in the didactic setting, maybe they even have an A in the class and they become confused about what's missing. They're not able to put those points together related to the steps associated with patient care, so they struggle, they get frustrated. What do we do as nurse educators? What do we do as nursing faculty to make sure our students don't get stuck or even freeze whenever they get into the clinical setting? That's what we're going to explore today. What does the NCSBN say about the 2026 test plan, and how do we best prepare our students for success? Welcome back, everybody, to Dr. Sellars Educate. Our mission is to support all nurse educator colleagues on the journey to achieve certification, whether that's CNE or CHESI, or maybe some colleagues are on the journey as a nurse leader to achieve your CNML. The only way that you will not achieve success is if you quit. Moving forward on your journey, there are going to be some challenges that come up, and we're going to talk about evidence-based practices in our snapshot today that will not only help us as nurse educators, nurse colleagues on the journey to achieve excellence, it also aligns with what the NCSBN blueprint says, or the test plan, and the CNE blueprint in order for us to achieve success. So first, what we're going to do is I'm going to flip over and we're going to take a look at some resources. So first and foremost, we're going to go to a couple of websites. So I want to share with you all that there's a wonderful website. Hopefully many of you are familiar with it, and it is NCLEX.com. When you go to NCLEX.com, you will find lots of great information, but what we're going to focus on today is the test plan. So first and foremost, you're able to go to NCLEX.com, and you will see an option at the very top for prepare. There's lots of options here, including the test plan. And then there's a section about, and there's information about exam day. This is going to help your students as well. Results, FAQs, lots of great information. So this is where we want all faculty to go for those colleagues that support students in the pre-licensure program. This is where we want you to go to find information. And then we're going to take a look in a second related to the actual categories. So what are those specific concepts that we need to make sure students are focusing on when we're developing our curriculum? All right, so those are the resources you're going to take a look at. Again, that's NCLEX.com. And then last but not least, you're going to also go to nln.org. Okay, when you go to nln.org, then you're going to choose to go to the menu section and choose NLN credentialing. This is going to take you to the certification division. You'll click on learn more, and then we want you to take a look at the handbook. Okay, so if you're on the journey for CNE clinical, CNE PV, or CNE novice, they each have their own handbook. Okay, so that's what you're going to look at. And we're going to come back to this content today and at the end of our time together today. And of course, you want to make sure that you use the Billings and Halstead textbook. Billings and Halstead really is our primary source for information to help us dig deeper. And if you want to go ahead and flip over to page 336, this is going to give you some additional resources that's going to help clarify any muddy points that you have. When you're moving forward on the CNE journey, because there are so many sub-competency statements, colleagues are quick to get overwhelmed, and we don't want you to get stuck. We don't want you to get in that position. So by giving you specific resources to help you move forward on your journey is going to decrease the cognitive workload. So it's going to decrease that anxiety, and it's going to help you stay focused as you move forward on your 7-week study plan. It only takes 60 days to pass the CNE exam. I know some colleagues question us when we say that, but that's really only the amount of time that you need. All right. And we're going to talk in this snapshot about how do you dig deeper into that statement, specifically when you're mapping out your 7-week study plan. All right. So what we're going to do now is we're going to flip over and go to Prezi. If you're not familiar with Prezi, it does take a little bit of getting used to for sure, but it is another great platform to engage students in a different kind of way, to help them clarify their muddy points, and ultimately to increase engagement. When we're using different technology, even gamification with our students, we want to make sure that it's purposeful, right? So we should always align it with our learning objectives, our learning outcomes that we want our students to achieve. I want to take a look at this quote because I thought it was really unique. And funny part of this story is when I found this quote, what I also discovered is that this is a ghost author. So nobody apparently knows who Alexandra Trenford is, but I think it's a really good quote. Okay, so let's take a look at it and really talk through what it means and why I really like it so much. The best teachers are those who show you where to look, but don't tell you what to see. I want you to take a second and really reflect on what that statement means to you and why do you think it's relevant in nursing education? Again, take a moment to engage in reflective practice, looking at this quote. Go ahead and write down what does this quote mean to you and why do you think it's important in nursing education? So I'll go ahead and share my thoughts and we'll see if it lines up with yours. When we talk about teaching or facilitation of learning, that aligns with competency one. When we're on this learning journey as an individual, especially as an adult, we come in with some experiences. Some of them can support us on the learning journey, and some of them can become barriers. Sometimes students come in with biases or beliefs that may or may not be true. So, some of the time, we're having to dispel some false information that students may have received or may have observed when they come into the classroom. Maybe they've been in clinical and the evidence based practice that we're discussing doesn't align with the clinical practice that they are seeing. So, we want to be clear about clarity for all of our students that is needed. And in order for us to do that, we have to show them the evidence. Okay, so that's really what popped out for me when I read this quote is showing our students where to look. Just like we go on the journey with you all, we started out doing a little bit of a show and tell, right? We went to the NCLEX website. We went to the NLN website. We looked at Billings and Halstead. You now know what pages in the sixth edition, that is, you're going to go to help have a deeper understanding of the concepts that we are exploring. And then the second part I really liked is, but don't tell you what to see. This allows our learners to really engage in this learning journey for themselves, right? To create meaning associated with what they see or what they process related to the information that we discussed. Oftentimes, our students don't know what they don't know. And a big part of helping them ask more questions, it requires us to engage in Socratic inquiry or Socratic questioning, where we're asking open-ended questions with our students, right? So I want you to continue to think about this quote, maybe even take a screenshot of it, maybe even talk to your students about what it means to them. When we're able to engage in these deeper conversations with our students and really allow time for them to process the information like we did starting out in the snapshot, our students feel more connected to the learning. Now, I know we have lots of content to cover, lots of content to discuss, and oftentimes that can be a barrier in allowing students really to process information in a meaningful way. Welcome back, everybody. If you all have not yet, we want you to go ahead and print out the study worksheet, subscribe to this channel so every single time a new snapshot is released, you'll be notified right away. That usually happens every Monday morning at 9 a.m. CNE in 60 days, you only need 60 days to achieve that passing score on the CNE exam. The number one reason why colleagues are not successful on the CNE exam is lack of proper preparation. Your ability to make sure you're using the right resources when you're mapping out that 7-week study plan has to be a concentrated, focused effort. Okay, so that's why so many colleagues are successful when we partner with them, is because we keep them focused, right? We only make sure they're looking at information that is going to help them achieve success. There's also a link right here in the description that will take you to the CNE in 60 days, and you can see all of the upcoming sessions that we have available. And there's nothing else for you to buy. That's why the CNE in 60 days program is so effective. In addition to us engaging in micro learning, so every week we're dropping information, we're dripping content that is aligned with all 8 competencies, or if you're on the clinical journey, that would be 6 competencies. And then what you want to be able to do is to apply it. 70 to 80% of the questions on the CNE exam are at the application analysis level. Okay, for the cognitive learning domain, we know there's a Bloom's taxonomy that has levels. That lowest level of the cognitive learning domain is remembering or memorizing, right? Knowledge. That may be where you start. However, we want to scaffold, we want you to draw from prior learning until you get to that highest form of learning, which is creating. You're able to connect the dots, just like our students, in a way that allows you to make those decisions when you get to the CNE exam about which option is the correct answer. You will have 3 hours to take the CNE exam. There are 150 questions, and you will receive your score as soon as you submit your exam. Okay, so when you're looking at what your plan is going to be to take the exam, we always recommend you go to a testing center because there's going to be a proctor. They're going to be able to troubleshoot any technical issues you have. And that's going to also decrease your anxiety because you don't have to worry about what happens if my internet stops or if there's a storm and there you lose connection for whatever reason, right? So it just decreases your anxiety when you go to a testing center. All right, so let's get back to NCLEX. I attended a symposium yesterday and it was fantastic. There was actual representatives from NCLEX, from NCSBN, that talked about NCLEX. And of course, they have to make sure they're consistent in their messaging and they're not sharing information that's not available for the general public. And one of the key points that she talked about was going to the NCLEX website. Okay, so that's why we started at the actual website so you could see for yourself where you're going to go to find this information. When we're preparing our students for the NCLEX, we are going on the journey with them. NLN CNE journey is the exact same way, or Chessie. And what you have to figure out first and foremost is, what does my roadmap look like? What does my blueprint for success look like? And it starts by taking the time for the NLN exam. You're going to print out that candidate handbook, which has the blueprint. Okay. The second step you're going to take with your students is going to be related to alignment. Okay. So proper preparation is going to start, number one, with the textbook. Number two is going to be with alignment, right? We have to have structure. Now, there's a strong parallel between NCLEX and CNE exam. That's why we're talking about it today as one. Number one, many of our students right now are getting ready for NCLEX. So it's a very timely subject. And when we're thinking about these teaching strategies, that's ultimately what we're doing. We are integrating evidence-based practices that is aligned with what Billings and Halstead tell us we should do, how we should engage, how we should evaluate, how we should align our content in the course to ensure that our students are learning, to ensure that they are able to meet the learning objectives, the learning outcomes that we expect them to, and ultimately that they're able to pass NCLEX and make safe patient care decisions. All right, so first, it's going to be proper preparation, making sure that our students have the correct textbooks that are needed to really be the source of truth, okay? And then the second step is structure, okay? Alignment. So what we're talking about when we say alignment, let's go back to the NLN website. So I'm going to flip over now to our other view, and you will be able to see the actual website again. All right, because now what I want us to do is take a look at the actual test plan. Specifically, we're going to go ahead and take a look at, there we go, the client needs categories. So what we see is safe and effective care environment, health promotion and maintenance, psychological integrity, and physiological integrity. These are all categories that we want to ensure are covered or included in our curriculum. So when we talk about structure, these are the key elements we're looking at. Okay, so let me give you one example. When we talk about safe and effective care environment, we want to make sure, as an example, students understand the disease process of heart failure. As an example, if you don't know already, my background is cardiac, so all of my examples are going to be cardiac because that's the clinical area that I have the most knowledge about. So when we think about care of the heart failure patient, there's a pathophysiology component to it. There's also, from a pharmacology standpoint, We want to make sure that they understand the medications and what those medications do to the patient. So let me give you an example. With heart failure, we know that furosemide or Lasix is often given. So we want to make sure that students understand that Lasix will cause patients or clients to get rid of a lot of fluid, which is a good thing. However, we also want to make sure, number one, we're tracking their I's and O's. How much are my patients drinking that have heart failure? What is the restriction? Oftentimes, there is an intake restriction. So, what is that level or the maximum amount, cc's, mLs, that my client can have for the day? Okay. And then from the same angle, I want to make sure that it's being excreted. So I want to look at the output, right? So I want to think about the I's and O's and how I'm tracking that as a nursing student. The second component I want to look at as a nursing student is the assessment. I want to see if there are signs of any type of fluid retention that this patient is having. So I'm looking at the feet, right? I'm looking at the ankles. I'm determining whether or not there's pitting edema. I'm looking at the patient's or the client's face, right? I'm looking at their extremities. I'm listening to their heart sounds. I'm making sure that I'm doing that full assessment to validate what my intervention should be associated with care of the heart failure patient. And then I want to think about next step number 3 is going to be the medication. So, what medications are my patients on? I mentioned Lasix, and how is that going to affect their body? So, I know that if I'm given Lasix, then my patient is going to have more fluid coming out of their body. Well, what happens when they get rid of a lot of fluid? That's right, electrolytes go out with it too. So, I want to think about any lab work, any x-rays that my patient has had. I want to see, okay, what did that x-ray show, that chest x-ray from yesterday? Have there been changes from yesterday to today? I want to look at the potassium level, the magnesium level, the sodium level. As a nursing student, we want to make sure that they are looking at the holistic care needs of a heart failure patient as they're thinking about what interventions and what the possible priorities may be for me as a nursing student taking care of that patient. Okay, so we want to make sure that we're having these conversations with our students in order for them to properly prepare for the care that they're going to give. Just like Patricia Bennett talks about, though, we can't wait to talk about care of that heart failure patient when we get to pre-conference, right? That's too late. We have to be able to ensure there is structure in place in the didactic setting so our students feel like they are properly prepared to make practice decisions. The other point that I just thought about that the NCSBN colleagues made yesterday was related to practice readiness. And I haven't really I had not thought about it before until she mentioned it because she had a question mark. And I've said practice ready many, many times. However, I think we do need to shift the paradigm. I think we need to think about what are those core skills that students need to have. Again, need is the really important part. What skills do our students need to have in order to make safe patient care decisions? When we talk about that practice readiness, we know they're novice as nursing students. So we have to think about and really partner with our practice leaders in the clinical setting to talk about that bridging that practice to theory gap. What is that going to look like? We should have residencies. We should have an orientation and an onboarding that's going to address the gap so that students can feel more properly prepared to make those safe patient care decisions. So again, when we talk about structural alignment, number one is going to be looking at that test plan, looking at those client needs categories, and then second of all, making sure we have the textbook that is going to be able to align those practice decisions with the evidence. And then, of course, giving students a chance to engage in unfolding case studies and other discussions that is going to allow them to think through what that patient care process is going to look like. All right, hopefully that was helpful. I know we kind of went deep really quick. All right, so we already talked about the client needs categories, and that's a good step for you all to take too. Whether you're in the pre-licensure or post-licensure, this is really about engaging with your curriculum to ensure that it's aligning with those learning objectives, those programmatic outcomes, as well as the textbooks, the resources that we are using to help solidify and have that deeper comprehension of knowledge that we need for our students to have. And then the last point we want to take a look at is alignment with our NLN blueprint. Okay, so we're going to now flip over to sharing that blueprint again, that again is included in your handbook. So when you go to the NLN website and you click on, as an example, we're just using CNE, but whatever exam you're planning to take, you're going to see a handbook. And within that handbook is going to be a blueprint. Now, we did go ahead and highlight the section that we're aligning with our conversation today. And this is under competency 1. It says creating opportunities for learners to develop clinical judgment. The first step that NCSBN talks about related to clinical judgment development is recognizing cues. That goes back to assessment. And if our students don't have a solid foundation in their assessment skills, they're going to struggle. And more importantly, they're going to make delayed or unsafe patient care decisions because they don't recognize that something's wrong, right? So we want our students to be aware of the data as well as the assessment that they need to do. That is physically looking at the patient, talking to the patient, as well as touching the patient to truly do that comprehensive assessment that needs to happen in order to make decisions about whether or not something is on track or if there is cause for concern. And then the next step we want our students to be able to take is to look at the data, right? Look at the lab work, take vital signs, look at x-rays or other information that they may have related to what next steps should be, what possible interventions may be necessary. When we're looking at creating opportunities, that responsibility is on us. We have to think about what are those teaching strategies that we're going to use to help our students truly advance their level of clinical judgment, move to the next phase. Okay, they realize that the patient has more swelling. They have some, maybe even 2 to 3 plus pitting edema in their extremities. Okay, so they've recognized that something is wrong. Now, what are the next steps going to be? What are those possible interventions? What is that conversation going to look like with the provider? What else do they need to do before they even call the provider? So that's what we're looking at. How does it align? We started with, again, looking at that test plan from NCLEX. How does it align with the NLN CNE competencies? Well, there's a direct correlation, and that's exactly the step you want to take. When you're preparing for the CNE exam, you want to think about, why is this important? Those nurse educator competencies really make sure that we are creating the best learning experience for our students, and we're able to most effectively do that when we're not just focusing on achieving that passing score, which is important. We still want you to achieve that passing score on the CNE exam, and it's more important that you're engaging in this transformational process of becoming an even better nurse educator. All right, so stay with me. We got a few more slides, and then we're going to talk about our thought-provoking question. All right, and then we talked about alignment with the blueprint, and this is what we want you to do. All right, so if you haven't already, go back, look at that blueprint, and we want you to think about going through all 63 of those sub-competency statements, and we want you to think about, where are you today? Number one, as it relates to having that deep comprehension of that concept. Maybe we looked at clinical judgment. You're thinking, I don't know what she's talking about. NCSBN, NCLEX blueprint. Well, here's the reality. Even if you're in the post-licensure program, the CNE exam, all of the exams really are more aligned with the pre-licensure experience. Okay, so it doesn't mean you can't be successful if you're in the post-licensure program. If you teach at that level, it just means you're going to have more probably study time as it relates to exam analysis, assessment strategies, because oftentimes we don't give a lot of exams at the master's level or the RN BSN level. However, we do for the MP program as an example. So there may be some additional study time that you spend on certain concepts because you just don't experience it in the post-licensure program. All right, so now we're ready to go to the thought-provoking question. Let's see what you think. And remember, it's exactly what it says, right? It's thought-provoking, so don't become anxious if you have no idea what I'm talking about or if you don't get the correct answer. A nurse educator observes that students can accurately explain key concepts during class discussions, yet in simulation and clinical settings, they hesitate. rely heavily on instructor direction, and struggle to adapt when patient conditions change. Which instructional strategy would best support learner development and promote independent clinical decision making? A, design review sessions that reinforce essential concepts and address knowledge gaps while gradually increasing content complexity across the course. B, implement guided case study learning experiences that require students to make decisions, justify their reasoning, and reflect on outcomes during facilitated debriefings. Or C, provide clinical checklists and step-by-step protocols to reduce uncertainty and ensure consistent performance across learning environments. All right, I want you to take a few seconds to write down what you think the correct answer is. And we also want you to take a second to write down the rationale for the incorrect answer. The CNE exam will have three options, just like this one. Only one is going to be correct. All right, so hopefully you had a chance to write it down. If you chose B, you are correct. Give yourself a round of applause. And now we want to talk about the why. All right, so we're going to talk about the rationale and hopefully it will make sense to you. If not, I want you to take some time to really process the information, use Billings and Halstead to take a deeper look as it relates to clinical judgment. You'll see some information there. And not only in chapter 18, which is talking about teaching in the clinical setting, but you'll also see some information as it relates to ways or strategies for evaluating learning outcomes in chapter 24, because that's another big part of it is you want to think about not only how we facilitate, how we support the learning journey with our students, making sure they don't get stuck, clarifying muddy points. We also want to think about whether or not the tool is appropriate. We want to engage in formative assessment, and we know summative is also really important, right? So just looking at, as an example, table 24.1, you may want to consider different assessment and evaluation strategies. Okay, so let's talk about the rationale for B. Option B is going to promote clinical judgment, reflective practice, progressive independence, and socialization into the professional nursing role. This scenario highlights a gap in learner development, not content knowledge, right? So when you go back and you look at the question, that's what the concern was, right? It wasn't that the student was struggling in the classroom. It was that they didn't know what decisions to make at the bedside independently. Okay, so you want to think about what that question is asking you so you can have clarity about which option is correct. Because oftentimes when you get to the CNE exam, it may be two good options, but there's only one best option. All right, and then competency 2 emphasizes supporting students as they transition from dependent learners to confident, independent practitioners. The goal is not to remove the struggle, but to structure it in a way that builds confidence, reasoning, and decision making over time. I really like this thought-provoking question. Hopefully you all do too, and how it really breaks down each of these concepts. That's what's going to help you feel more confident when you get to the CNE exam. Taking time to really break down the concepts and have a clear understanding about the rationale. That is one of the benefits of Dr. Caputi's CNE review book. At the end of every chapter, if you do have that as an optional textbook, we do recommend it, but we want you to make sure you're starting and really spending more time in Billings and Halstead. Specific page numbers is key, though. You don't need to read every chapter in Billings and Halstead. That's part of our goal with the 60 days journey that we support you on, is focusing on specific page numbers so you don't waste time. Transformational journey is what this is all about. There's a transaction that's happening right now. You're exchanging your time, your precious time, for information to help you close your knowledge gaps, to help you become a better nurse educator. Or maybe you're a nurse just tuning in thinking about becoming a nurse educator. That's great too. There's a transaction, there's an exchange, right? You're thinking about what your return is going to be on your investment, which is your time, your most valuable asset, right? Because we can never get it back. However, there's a transformational journey that we're taking you on. We want you to think deeper. We want you to have a better understanding about the why. That's what's truly going to help you become a better nurse educator and ultimately help our students make safe or patient care decisions. So, what's your number? How do you feel about this content? One, you feel lost. Maybe you have no idea what I was talking about. Maybe I lost you after 5 minutes. Or five, you feel ready to teach. We like using this barometer or temperature check throughout our program when we're doing our live events because we want to make sure we're not leaving colleagues behind. And sometimes there is a one that shows up in the chat, or colleagues will pipe in and say, "Oh, I'm a one." And that's when we just slow it down a little bit and we reconnect, we re engage with our colleagues to make sure that we give them additional information to help them move forward. And I know it can be somewhat overwhelming to feel like you have to choose an option when we're going through the thought provoking questions. But remember, that's why we call them thought provoking questions. Even if you're not sure about the correct answer, our goal is that you have a deeper understanding of the concept. We hope that you've enjoyed this snapshot. And if you have any questions, make sure to reach out to us, info at Dr. Sellars Educate. We look forward to seeing you in our next CNE in 60 Days program. You can go to our website to find out more information. We hope you have a great one. Take care, everybody.